I am Dr. K.A.Reddy, Chief Implantologist at LBR Dental and Implant Center. I am also Chief Mentor for Biland Dental Implants. I am also full mouth rehabilitation consultant with the pterygoid and zygomatic implants all over India. Today in this video, I am going to explain the different components of the conventional implants. Many doctors have been struggling to find this conventional implants, but today I will make it very clear for them. I'll give a demo on the STL model. I'll place the implant also on the STL model, and I'll use the various components and explain you in detail. Now in this STL model, I'm just drilling for a demo purpose. I'm drilling the STL model. Now the manufacturer supplies the implant along with the mount. Sometimes the manufacturer also supplies without a mount. So this, if the mount is supplied, it is mentioned on the label that it is a mounted implant, or sometimes it is without a mount. If the advantage with a mount is, once you place it in a mount, then you can use either a ratchet. This is called a ratchet. You can place it, you can take this and then carry the implant along with the ratchet and then place it into the index finger to hold this implant mount and then torque it. See, if you can see here again, once the desired torque is reached, the ratchet will break here. Okay, now this have set it at the 30 torque, Once the 30 torque is reached, it is breaking here. So I can increase the torque now with a clockwise and then again turn it inside. See, now again it is breaking at 45. Okay. Now after placing, the implant has been properly inserted, you remove this ratchet along with the mount. Okay. We have to take the impressions. We can take impressions with a direct abutment level impressions. You can take direct abutment level impressions where this is a straight abutment. You also have a angulated abutment. Angulated abutments are available in 15 degree and the 25 degree. This is the straight abutments. So now I am placing this straight abutment here. This is a screw for the straight abutment which goes inside like this. So now we'll fix this, the same hex drive. What you do is you try to fix on the implant. Now see, it's got fixed. So you can take a direct impressions. This is called as abutment level impressions. Okay, or you can also take with a this part of this is called a closed tray impression. This is for the closed tray impression. So what we do is we place this and then just push it there. There is no, remember, for the closed tray impression there is no screw here. It is just a locking method. See, that's all. Or this is for a closed tray impression. In my next video, I will going to demonstrate what is a closed tray, what is an open tray impressions, and how we take open tray impressions and the closed tray impressions. And there is one more called as, this is for the open tray impressions, and this is for the retention of the putty material. And the screw, if you remember, if you see, the screw is longer here because this has to project out of the impression tray. Whereas here in the abutment the screw is very short, whereas here the screw is long enough. So now what I do is I'll fix it here. See now. Okay. So once we place this tray here, now this has been fixed here. Now once we place the tray here, we make a opening into the tray, we make a hole into the tray, and the tray is fixed here. This will be projecting out, and once you take impression with the putty material, so what you do is you just remove this. So imagine this, my finger as a putty material. Once you remove this tray, this screw comes out, put this screw aside, and once you take this putty, it will this component will come into the putty. This is for the open tray. So what we do, I'll show you a dummy implant analog. So now once we take, now this will be, this portion of this closed tray will go into the putty, and what we to use is, this is the implant analog. That means it is a replica of implant, but it is a lab analog. This is a lab analog for a regular implant, and the lab analog for the multi-unit abutment is different. I'll mention again. This is for a regular implant. So once this portion comes into the putty, what you do is fix a lab analog like this, and once you pour the model over this, it comes into the like this, and over which the lab guy fixes an abutment like this. When the abutment is fixed onto the lab analog like this, and then screw it up. See, if you can see, the lab analog is fixed to the abutment. If this is whether it is open tray or now closed tray. Implants have been placed in a different angulation, so we need to use a multi-unit abutments. So to make it parallel, we need to use a multi-unit abutment. So now the implant is there now. So what we can do is, you can do either this is a straight abutment, this is a straight multi-unit abutment, or this is a angulated multi-unit abutments. These angulated multi-unit abutments, are available from 0 to 60 degrees, depending upon the angulation at which you have placed the implant into the bone. So now what I am trying to do is, we have placed this implant, so we have to either fix the straight abutment or the angulated abutment. Now this implant I am going to fix here. See here. Okay, this is a guiding pin, so this will determine the angulation. This will determine, suppose imagine this implant has been placed in a mesial inclination like this, mesial inclination, or if this is a pterygoid implant, this has been placed in a distal angulation like this. Now after placing this implant, now this multi-unit abutment, after placing the multi-unit abutment, this come like this. So this is a guiding pin for the multi-unit abutment. This will determine how much straight the multi-unit abutment is going to come. So after you place like this, keep a finger on this guiding pin and then tighten this screw. There is a screw which has been provided along with the multi-unit abutment. So just tighten this screw. If sometimes if this placing with a handle is becoming difficult, so you can also use a hand driver along with the prosthetic hex screw. This is a prosthetic hex. The prosthetic hex, fix this prosthetic hex onto the hand drive. So you can also place it like this. In case of pterygoid implant, zygomatic implant, the access will be easier. Now this has been placed properly, fixed properly, and even this multi-unit screw should, now we have placed this implant at a torque of more than 35 degrees, 35 torque, 35 NCM. Now this implant has been placed at more than 35 NCM torque. Now followed by the multi-unit should be placed not more than 25 NCM, because the multi-unit screw will break, or sometimes if you turn it at a 40-45, then implant along with the implant, along with the multi-unit, implant also start rotating. So always the implant at highest torque, then followed by the multi-unit, then followed by other screws. Now remove this guiding pin, remove this pin. Now this multi-unit has been placed. Now what you do is, you take a open tray impressions like this. Now this is an open tray transfer for the multi-units. Now remember, don't get confused with the open tray transfer. If you see this multi-unit open tray transfer, this has got a wider opening. Whereas if you see the open tray transfers for the regular implant, there is no wider opening. It is just a hexagonal hex is there. Hexagonal hex is there. So this is for the regular implant, whereas this is for the multi-unit. That means this is open tray transfer component for the regular implant. This is open tray transfer for the multi-unit abutment. So now today I am going to place this multi-unit abutment open tray transfer on the multi-unit abutment. Now remember, see how it is getting fixed. Now just turn this screw. Now see, then the screw is fixed now. Now what you do is you take an impression. Once you record this, now this rough surface is created so that the putty material, impression putty material catches this and hold it properly, and just you can just remove this screw like this. After you take impression, just remove the screw like this. Remove the screw like this, and this will remain there. Okay. So now when you take out this putty along with this, the putty, this open tray transfer will come into the putty. Then again here, what the difference is, in the regular implant, what we have used is, this is the, for a regular implant, this is the lab analog. Whereas for the multi-unit abutment, where multi-unit, the lab analog is different. If you can notice both of them, this is for the multi-unit abutment, lab analog for the multi-unit abutment. This is lab analog for the regular implant. Now see this. Now this will go and fit into this wide opening. Now it will fit like this. And once you pour the model, it will come into this. You have to the same screw back again like this. Take a hex drive. Now if you see this assembly is perfect. Can you see? Now this is a lab analog, whereas this is an open tray transfer. So once you pour the lab analog, the model will come like this, and you can remove this. Come like this. This will come into the stone. This will come into the dental stone, over which then again over the lab analog we are fixing this temporary cylinder to make the hybrid dentures. Again, there is a separate screw which is been provided for this. We can fix it and start making the processes.